So I just moved to Chicago in 2012, and I had noticed a few months later that there was a bump on the top of my foot. I didn't realize that it would be cancerous at all. I just thought that, it was something unsightly that I wanted removed. So I went to a local dermatologist and asked him about it. He had it removed and had a biopsy taken of it, and it turns out that it was melanoma.
It's never good to get cancer, and certainly in a young person, it's not good to get cancer either. Anybody can get melanoma. The fairer your skin, the lighter your eyes, the more easily you sunburn, the more poorly you tan, the greater your risk for getting melanoma. But even the darkest skinned individual can still get melanoma.
Prior to being diagnosed, I knew about melanoma, but it wasn't really a concern of mine. I would go to the beach with my friends. I wouldn't wear sunscreen just because I wanted to have that nice tan, sun-kissed look. Went to the tanning beds, and I didn't really think anything would happen.
When you're a teenager, you think you're immortal. But the reality is 1 in 5 Americans are going to get a skin cancer sometime during their lifetime. You can't totally prevent melanoma, but you can lower your risk. If you wear protective clothing, if you avoid the midday sun when the rays are the strongest, and you regularly use sunscreen, those 3 things together can lower your risk.
When I think of melanoma, I think, okay, there's a spot on my skin, they remove it, and then that's it. I didn't realize that my chances of getting melanoma would be even higher since I had it just this one time.
It's not unusual for us to see primarily women in their 20s with melanoma, so Christa is not that unusual. But what I would tell Christa is that you've had a melanoma, you have about a 10 to 20% chance of getting a second melanoma sometime in your lifetime. So for that reason, you need regular checkups every 4 to 6 months, full body exams, because when that second melanoma pops up, if it does, you want to make sure you detect it as early as possible.
It didn't really register with me until I started getting deeper and deeper into my treatment and realizing how it affected my life so much.
We have to detect melanoma early to lower mortality. MelaFind helps us achieve that goal because it gives us the additional information to help us be more accurate in our biopsy decisions. With our eyes, we can see with visible light. MelaFind lets us see through visible light and through infrared light and see down several millimeters into the skin. With this additional information, when it's analyzed by MelaFind, it helps detect the earliest melanomas. It helps us determine which are the most suspicious lesions, the ones we need to biopsy.
It's very exciting that doctors now have products like MelaFind that they can use to determine whether a mole on a patient's body is dangerous and needs to be removed.
Melanoma is probably the most clear-cut case of a cancer where if you catch it early and treat it early, it's not that big a deal. But once it is spread, basically nothing works.
There's a 100% cure rate if you catch it early on. That's why it's so important for people to go to the dermatologist as soon as they see something right away.